During the pandemic or rehab centers, they have seen a big increase in people struggling with alcohol. And 13 Action News reporter Kelsey McFarland joins us again to show us the alarming trend and also when is it time to get some help.
It starts innocently enough.
It wasn't like, shame on you for drinking. It was like, hey, we're in a pandemic. The world's, terrible. Let's have a cocktail.
The pandemic destroyed our daily structure and kept many socially isolated, allowing us to lean into things like Zoom happy hours and alcohol deliveries.
So that alcohol use has gone up tremendously.
Michelle McGinnis is Chief Clinical Officer for Landmark Recovery. Their center in Las Vegas just opened in December. She says their rehab centers across the country have been incredibly busy.
We're seeing more opioid use with alcohol now, or those that hadn't been using alcohol at an addictive rate are now using alcohol at an addictive rate.
She says the pandemic fast-forwarded habits that normally would have developed over several years. It also made the battle much harder for those already in recovery.
And it's already hard to ask for help. So when there were actual physical barriers to getting help, just really didn't help the situation. So we've definitely seen relapses that were more significant than and quicker than they were.
Michelle says there are a few red flags that indicate it's time to get help. If you're drinking more than you had planned, more often than you were using before, or for a longer period of time. Another, if drinking starts to interfere with your daily life.
If we have had any negative consequences as a result of our use, but then we still are drinking, that's certainly a warning sign that drinking has kind of tipped that, kind of crossed that threshold.
The first step in getting help is removing the shame and stigma.
Saying it's okay and I need help. That's a huge first step.
There are different levels of care for different people. Michelle suggests talking to trusted friends and family, exploring self-help groups, talking to a therapist, or visiting a rehab center. Kelsey McFarland, 13 Action News.